Today we're going to demonstrate one of the first videos in the country of the Arthrex new soft tissue button tightrope technique. This is doing a quad ACL all inside. So we're going to drill our standard tunnel for the femur. Again, here standard reamer. This is a low profile reamer, and then we're going to drill the 4.5 tunnel. Then we're going to use our flip cutter, which we positioned in the anatomical position. We're going to do this about 30 millimeters to make sure there's no bottoming out. And now that we've done this, we're going to clean out any of the reamings. And so the key is to keep the flip cutter in the knee, just deeper in this tunnel. And then we're going to debride out the soft tissue. This is all standard for a standard all inside. Now, out of the medial portal, or with a passport in there, we're going to pull out the stitch. And you can see here the stitch also in the femoral tunnel. Following this, we're going to prepare the fiber tag tightrope with the all soft tissue button. You can see here the button is yellow. This is a very similar technique, or pretty much identical, to when you do your standard tightrope techniques with the Arthrex metal button. We're going to do multiple passes. Again, my physician assistants are quite excellent at this technique, and so this conversion to the soft tissue button was very easy overall. Here you can see that we're going to do the sequential half hitches and loops. Following this, we're going to continue to pass this through. We're going to tie it and then bury the knot as you would for a standard ACL tightrope. And again, this button is radio opaque, so you can see it on the cortex, which will make you feel confident that you have pulled it through appropriately. We're going to measure the graft to make sure we have appropriate length. Again, it depends on the height of the patient, the length of your tunnels, etc. Here now we're going to place the other button. The nice thing about this button in the tibia is you do not need to attach any sort of metal button to it. It is already built in, and you'll pass it down, so it's slightly opposite of the way you would normally do it in terms of the button fixation, but it does actually save some time overall. Again, the really nice part of this is both of these buttons will conform really nice to the cortex, both in the femur and the tibia. And you can see here we're again repeating these passes through the fiber tag tightrope. And again, this quad autograft has been prepared. We've made sure that it's been sized appropriately, and we will also place vancomycin on it before placing the knee. You can see the yellow. This is again radio opaque, but there is no metal here, which is really nice for any type of MRIs or other things that will be needed further, and obviously for patient preference for no metal as well. Here we're going to tie. In addition, this button flattens out to about 11 millimeters in diameter, so it's actually a larger surface area than the buttons that currently exist, as they're about 12 millimeters in length, but only a few millimeters wide. So it's actually more of a circular button on both sides, which is really nice, through the same holes. There is no changing of your technique for drilling in this all inside. So you can see here again, you have to slightly lengthen each side, and we're going to mark out how much we want in the tunnel. We start off with, our goal is about 15, but we can go a little longer if needed in the femur. In addition to, we have about 20 in the tibia in case we're concerned about the thickness of the graft slightly lower down. Again, we're going to put vancomycin on this. We're going to leave it on the graft prep station to take out any of the creep. Again, now we're going to pass this. Now the key here, as this is a standard pass, is that this is slightly different than the button because you really want to hold on to these tiger wires. As you can see, the button has not been fully deployed. It's actually lengthened. So you're going to hold these tiger wires tight, and my physician assistant will pull on the blue stitches and then also bring the white so you do not have any slack. Again, you're starting to pull the graft in, and we're looking at the tunnel. You'll see this in a minute. So you can see as we're pulling both the whites and the blues, I'm holding on the tiger wire the entire time. You can see that while the button deploys to almost an 11 millimeter round button, it can go through this hole quite easily. Now what I'm going to show you is that you can pull the internal brace and it'll engage it. It's okay to see a little bit of yellow. That is not an issue. That means that it's actually sinking into the tunnel nicely. Now again, you can pull it back out, which is really cool. This is actually a new feature that's not available with pretty much any of the buttons on the market. So now we're going to stretch it out again, pull it back out, holding that tiger wire. Again, do not remove that tiger wire until you're ready to final fix the button. Now we're going to pull the internal brace again hard, and then you can also tug slightly on the whites to make sure that it's deployed. Holding really nice. You can see that no matter how hard I pull, this will not pull through. I'm watching it the entire time of the femoral tunnel to confirm this. You can see it looks like a flower formation. It will actually collapse as you engage the tightrope. So now what we're going to do is slowly pull the tightrope up. Now one trick here is to not remove the tiger wire until the quad graft is all the way in case you have any issues with pulling the graft through. Now we're slowly pulling this through. This is no different than with a standard button. Now once the graft is at least 15 millimeters, and you can see now we're going to start pulling to the tibia. So the trick here is now we're going to remove the tiger wire because we're confirmed and we like the button. So now what we're going to do is grab the passing suture from the tibial tunnel, and we're going to pass everything. Now again, the key here is to pass the whites and the blues and the internal brace, but do not pass the tiger wire. This will be what you use to elongate from the other direction and control the pull. So you're pulling everything through, and again, there will be a lot of sutures, and be concerned it's going to tangle. It will not. Now you can see the only thing left behind is the tiger wire. So you're going to hold the tiger wire, and you're going to pull the blues, and then slowly pull the whites, and you'll see this will pop through. The nice thing here is the button is already engaged on there. So now all you have to do is just tighten it down. Once you feel good about it, you can actually remove the tiger wire. So here we're just going to check to make sure it's solid and there's no creep in the system, that the graft is dunked, and also that that is not bottomed out. Now we've removed the tiger wire, so the button is ready to be deployed. It will not elongate again. You can see this. The really cool part of this is we're going to get the internal braces out of the way, and then we're going to slowly tighten this down. Again, we are not going to touch the blue at this standpoint, and you can see how it balls up to an 11 millimeter essentially button, and this will conform very nicely to tibia no matter what the situation is. And the pull-out strength is excellent. So you can see we're slowly tightening this. Actually, one of the things we've noticed with this is that the tightrope mechanism is actually even smoother than with the button. And so you can see we can reduce the creep, check the lock when it's already quite tight. Then we're going to retension in the femur. And again, like I said before, the pull mechanism of the tightrope appears to be better with this new button, likely due to its design. Again, we're going to retension, and then we're going to tie, and you can see how well this is conformed. We've retensioned the graft on both sides. And then we're going to place the swivel lock with both the internal brace and the white sutures from the tightrope. We've again removed the blue sutures in this situation. I will do this in extension. You can see how well the button conforms. You can see there's complete return of the lockman. The graft overall is excellent. And one final check, you can see how the buttons have both collapsed. So they are radio opaque, but at the same point, there are no metal in the body. Thank you.